Good afternoon, everyone. I'm Dr. Chandana, a postgraduate student, Department of OBG from Karnataka, India. I'm going to present a study on maternal and fetal outcomes in anemia in pregnancy under the guidance of Dr. Srilata S., Professor, Department of OBG, ESI Medical College, Bangalore, Karnataka, India. Hello.
Yes.
Hello.
Yes, thank you very much. And now we would love to hear your presentation and to know more about your study that's been done. So,
Hello. Hello. Can you hear me, ma'am? Hello.
yes, we can hear you. And
are you able to see my slides, ma'am?
well, yes, we can see the first one, giving the topic of your.
Ma'am, yes, ma'am. Wait 1 second, ma'am. I'm not able to scroll down it. Yes. Okay. Anemia is the most important complication in a pregnancy in developing countries due to the high incidence and its severity. Anemia is a crucial among all nutritional disorder in all over the world. More than 50% female in the world suffering from anemia during their pregnancy. Developing countries like India has reported 87% prevalence of anemia in pregnancy. According to the WHO and Indian Council of Medical Research, less than 11 gram percent is considered as anemia in pregnancy. It is divided further into 4 degrees based on the severity. Mild degree means 10 to 10.9 gram percent. Moderate degree is 7 to 9.9 gram percent. Severe degree is less than 7 gram percent, and very severe is less than 4 gram percent. So what are the effects of anemia on mother? It includes the preterm labor, premature rupture of membranes, cardiac failure, infections, preeclampsia, abruption, uterine inertia, postpartum hemorrhage, and postnatal complications such as sepsis, venous thromboembolism, subinvolution, poor wound healing, postpartum depression, and fetal complications into low birth weight and premature status babies. And children having low hemoglobin levels they are at higher risk of long-term impairment in the mental and motor development, lack of concentration, short attention span, and easy distractibility. Hence, prevention of anemia is essential to have a healthy baby from healthy mother. Keeping all this in view, this study was conducted to find out maternal and fetal outcomes in anemia in pregnancy. So what are the aims and objectives? The first aim is to study the maternal and the fetal outcomes in anemia in pregnancy. And the inclusion criteria is all pregnant women admitted and delivered with a hemoglobin less than 10.9 gram percent. Exclusion criteria, the pregnant woman with HP more than 11 gram percent. So the materials and methods, it was a retrospective study done in the Department of Obstetrics and Gynecology at ESIC Medical College, Rajajinagar, Bangalore from January 2020 to December 2020. So 100 pregnant women who were diagnosed to have anemia and delivered at our institute were included in the study. The cases were traced through the parturition registers and case files collected from the medical record department. Maternal demographic profiles such as age, parity, previous obstetric history were noted down. Records about maternal comorbidities such as preeclampsia, diabetes, mellitus, polyhydramnios, and medical and surgical history were recorded. So details of physical examination, investigation such as CBC, LFT, RFT, like liver function test, renal function test, urine albumin, coagulation profile, obstetric ultrasound, they were noted. All the subjects were classified according to the WHO degree of anemia, and they were treated with either oral iron or intravenous iron transfusion or blood transfusion. Finally, the modes of delivery, maternal and the perinatal outcome were studied in all the study subjects. Data were entered in Microsoft Excel and statistical analysis were carried out in SPSS software version 24. Qualitative variables were presented as frequency and percentages. Quantitative variables were presented as mean or median depending upon the distribution of data. Bar diagram and pie charts were used for the graphical representation of data. So the results of the study include, the first is age distribution. The mean age of the study group was 24 years, and less than 20 years, it was 44% cases were there. 26 to 30 years, 39%. 31 to 35 years, 14%. 36 to 40 years, 3%. What we can see here is the prevalence of anemia was more found on less than 25 years of group. Then socio-economic status, that is, it is according to the modified Kuppuswamy classification. So majority of the women were belong to the lower middle classification. So the lower socio-economic status, it also predisposes for the anemia because of poor nutrition. Then here, among 100 cases, 35% cases were unbooked and 65% cases were booked. Then coming to the parity, so among 100 women, the 57 women were multigravida and 43 women were primigravida. And this shows that as the parity increases, the risk of anemia is more because of less spacing between the birth and poor nutrition again. Then this chart shows the degrees of anemia. So among 100 patients, the 24% cases had mild anemia, that is like between 7 to 9 that is 10 to 10.9 hemoglobin, and severe anemia was 18% who required blood transfusion, and moderate anemia 58%. So this is the types of anemia. The majority of the women, like 78% had microcytic hypochromic anemia, 22% had dimorphic anemia. So iron deficiency anemia was the predominant cause of anemia. This is distribution according to the treatment. Among 100 patients, 92 patients received oral iron and 46 patients received iron sucrose injection, whereas 16 women received blood transfusion, maybe because of severe anemia and also due to the intolerance to the oral iron. So these are the, this is a table showing maternal outcome. Gestational hypertension was seen in 7% of cases, gestational diabetes 7%, hypothyroidism 18%, oligohydramnios 10%, premature rupture of membranes 3%, and postpartum hemorrhage 12%. So gestational age at the time of delivery, the 14 cases had preterm deliveries, 86 patients had term deliveries. Mode of delivery, so normal vaginal delivery, 50% had normal vaginal delivery, 3% has undergone instrumental delivery, and 47% had undergone cesarean section. So coming to the fetal outcomes, so intrauterine growth restraint of the babies had NICU admissions. 55% babies had a low birth weight, less than 2.5 kg, and 22% had meconium aspiration syndrome. Then birth weight, 45% had more than 2.5 kg, 55% has less than 2.5 kg. So coming to the discussion, anemia is one of the most important public health problems, not only in India, but also in most of the Southeast Asian countries. The mean age is 24 years, which is comparable to the study done by Deirdre Geoloid et al. And majority of the anemic study subjects in the present study belong to the age group of 20 to 25 years. It is 44%. This was comparable with the results of Upadhyay C. et al. And low socioeconomic status is said to predispose to anemia, poor nutrition being the leading cause of anemia. In the present study, 70% of anemic women belong to the low socioeconomic group, which was comparable with the results of Upadhyay C. et al. And in the present study, 24% had mild anemia, 58% had moderate anemia, and 18% were severely anemic, which was comparable to the study of SS et al. In the present study, 65% were booked and 35% were unbooked, which was comparable with the study of Ashwati A et al. In the present study, 43% were primigravida, 57% were multigravida. Anemia in pregnancy is more common in the women of high parity due to the frequent pregnancy and inadequate spacing. The commonest type of anemia in the present study was microcytic hypochromic anemia because of iron deficiency, followed by dimorphic anemia, which was 22%, which was comparable with the study of Ashwati, Ranganakar, and Ali R. et al. In the present study, 92% of patients received oral iron, 46% received parenteral iron, and 16% received blood transfusion respectively. Maternal and fetal complications were like gestational hypertension 7%, GDM 7%, hypothyroidism 18%, premature rupture of membranes 3%, postpartum hemorrhage 12%, IUGR 18%, NICU admission 16%, and low birth weight was 55%, which was comparable to the study done by Upadhyay C. et al. So finally, the conclusion is anemia is the commonest medical disorder in the pregnancy, and it contributes to 40% of maternal death in developing countries like India. 90% of anemia is nutritional in origin. So hence, it is possible to prevent anemia in pregnancy with a better awareness and education in the society and by effective antenatal care. So this slide showing bibliography. Thank you.